any system that is thought of for the future has to limit the patient encounters to no more than 16 in an 8-hour shift, so that you can do the well child, do the preventive, you can do the chronic disease management, the consults, and you can do the acute care, so they're not in the urgent care or the emergency room. But rarely does payment and the number of visits comes up in the discussions, because we've been put in the treadmill like little rats with cocaine. And we've been told the more volume you do, the more money you make. And you cannot make up, if you're losing 50 cents on every visit, you can do 100 visits today. You're still losing 50 cents on every visit.
In fact, it works the other way.
Yeah,
When you start dealing with high volumes, if you look at any kind of business model, when the volume exceeds a certain point, your overhead expenses increase at a proportion with the income that you're generating. So it actually works to your disadvantage when you get to a certain threshold.
Yeah. Now, you seem to be concerned about the disadvantage of inner city kids in the system. Why is that?
Why? Because they're the ones that get the worst care, because they're subject to the lowest. They're at the mercy of a Medicaid system that is flawed, where there's such underpayment involved, and where people have been trained that they go to the emergency room for anything and everything. The physicians that work in those areas are basically also the same people that are compelled to do volume in order to survive. It's a situation that will not change until you start increasing the payment system to Medicaid.
Yeah, but what about compensation?
So hold on a second. So you see that too in the mortality rate, the maternal mortality rate, right? Medicaid covers 40% of deliveries in the U.S., and we have some of the worst numbers because of the lack of payment. But it's no longer the inner city. The rural kids, the kids in rural America don't have access to a pediatrician. They have the same fate as the ones in the inner city. And in many communities, this clinic that I help near Marine Base Quantico, 85% of the population is Medicaid. It's a suburb. It's not urban. But that's where the working poor go to live, and then they commute to serve the rich in Georgetown. So it's the same problem. So it's no longer a zip code problem. It's Medicaid is underfunded, broken, and a poor system to finance care for children. And it is preventing children in every community from having access to care. And quite honestly, what Aetna offers, a pediatric office, rates below Medicaid, I don't blame them, because I would say, Dr. Rogel, what percentage of your practice is Medicaid? Oh, X percent? But you seem to be able to make money off of them. So why should I give you a dime more?
The truth of the matter is, with the Medicaid, you don't have any co-payments or deductibles or co-insurance. It's the card. Come in, they bill, they're done. With Aetna or whatever, there's a co-payment that Mrs. Jones always gets mad about making that $25.
Yes. And when you look at what the Medicaid managed care companies, you're dealing again with a huge amount of the money going to administrative costs. That's absurd.
But you get my point, right? When you're willing to take $50 for a service that should cost $150, it doesn't matter what business you are. If I'm Walmart and I'm buying 1 million widgets from you at $50, and then comes Target and says, I know that these are being sold at Walmart for $50. So they're paying you about $50 for it. Why do you want $150 from me? I don't get it. What is it that you're doing for me that I should pay 3 times what you're paying Walmart?